just has hypertrichosis or anorexia, and I'll go through that too. That's another area where we see it. They're going to have it on their arms. They're going to have it on the sideburns. They're going to have it on the lip areas. You can also see it in those areas when it's medication induced, like if somebody's on an epileptic medicine, like Dianne. Anybody have any questions about that? Yes.
Are these more easily treated, or do they also turn into terminal hairs after being
I
treated?
think they're more easily treated because I don't think it's really stimulated by hormones. It's going to be an ongoing problem unless they're on a medicine that's causing it. So, you know, it's just something that they notice. It's something that's kind of stable, and so it's not going to be a thing that's continuing on. That's just been honest. Somebody, on the other hand, that has the hirsute qualities may be a longer determining if they're hirsute. So male pattern of growth, and so you've probably heard this before. So they're going to have it in a kite-shaped pattern. They're going to have it in areas where males typically have it. Upper thigh areas, it's going to spread out over the abdomen. Going to have a line of hair. A lot of times up here, chest areas. And I'm not talking about just the breast areas. The breast areas, most women have between 20 to 25 hairs per breast. That's considered normal. Where we would be concerned is if it's in the middle of the chest or if it's spread out over the top of the chest areas, and then of course onto the neck and the beard areas. And that would be coarser terminal hair. One of the things, and Julius Shapiro said this, where's Skip? Is he in here? Okay. Julius Shapiro said something that I listened to many years ago, and that was that he said, look at somebody's hands and the sides of their arms to determine whether they're hirsute. And I was just like kind of amazed at this thing. And what he said is, look at the sides of their arms and their hands and their fingers. And I don't know where he is, but he said, what you'll see is if you look at the sides of their arms and their hands, it'll look like a man's arm. They will have dark hair that goes down onto their arms, and the hand, Skip. Were you at the convention, the Hershey convention?
Yes.
Okay. Julius Shapiro talked about looking at people's hands and arms and fingers and knuckles for dark hair in hirsute women. Do you remember that?
I remember the show.
Okay.
But
Well, I don't know if you were outside, but Julius Shapiro talked about this, and this is something I always do, is I look at the sides of their arms and their hands, and I look for hair on the darker part of their fingers here to see if they have it, and that would be not just on this part of the finger, but down here. And if they've got it down there, we're dealing with a much worse problem. Yes.
Yeah, if anyone needs an example.
You got it. Are you PCOS?
Oh yeah.
Okay.
Have been plus Italian.
Plus Italian one, you
Plus
got
Italian.
double whammy there.
I still
Okay.
have it on my hands.
Do you have all the classic symptoms of PCOS?
Yes.
You do, okay. Because we'll talk about that a little bit. You might want to examine me back on the table.
No, you guys are fine.
We could work on you.
I've had where I've been 8% hair free on my body, messed up my hormones from switching something, and it all grows back.
Yeah.
So.
Well, anyway, those are things that I look at when when somebody comes into the office. And a lot of times they're kind of taken aback when I ask them to look at their hands. But a lot of times hands do tell a lot. And when you're looking at hands, you can tell a lot about
That was the first thing I had lasered. When I was 18,
Yeah.
my upper lip and my hands.
Yes. The PCOS patients, a lot of times, they're gonna notice it after puberty when they start having their periods. The longer the hormones have to act on the hair follicles, the worse it gets. So they're gonna see it at puberty, and it's gonna get worse and worse. 18, 20s, early 20s. So, and when they're in college, they're starting to notice that it's getting a whole lot worse. So they're gonna, at that point, probably have abnormal androgen levels. I think I'm hitting the shoot button Have you ever seen this? Yeah. Okay. So when I'm looking at the hands and the arms, I'm also looking at the elbows. And I ask them if I can look at the back of the neck. Because if they've got parasitism, they probably have a little bit of some other stuff. I mean, they may have, if they're PCOS, they may have some darkening. They may already have some insulin resistance going on. And I ask them, do you have any purple marks on your abdomen, stretch marks, striating? Or are your knees dark? Can I look at your elbows? And they're like, sure, yeah, that's fine. But sometimes they have this velvety patch on the back of their neck, or they have it in the creases. Their hands, sometimes they'll have knuckles. Their knuckles will be darkened around their fingers. There are many causes of this. The most common, I think, that we see are the one that they mentioned. This is acanthosis nigricans. But there's many causes for this. There could be insulin resistance. The person could have hypothyroidism. They could be on a certain type of medicine, like I think Addison's disease. You may also see some bronzing of the skin. Growth hormone therapy. Diabetes, I think I mentioned insulin resistance. Oral contraceptives. Sometimes with oral contraceptives, you're going to see the melasma on the face. Yeah, nicotinic acid. Some cholesterol medicines will cause it. But it's important to note, how many of you have seen a lot of this peach fuzzy, kind of long, accelerated vellus hair with people on cholesterol medicines, statin drugs? I have. I don't know if it's just that there's more people on statin drugs or what, but I know I've seen it. This is Addison's, bronzing of the hands. Sometimes you'll see people that come in that have this type of, it's an endocrine problem as well, hyperpigmentation of the hands. Sometimes you'll see it on the face as well. I just didn't have the lymph pictures on there, darkening skin, knuckles, back of the neck. Sometimes when you're looking at their hands, you'll notice a lot of dryness. Sometimes you can even kind of tell that they might be diabetic just by looking at their hands. I think there's a lot of information online, if you go online, about looking, diagnosing things by hands. And I do want to tell you that we're not doctors. We can't diagnose things. That's really important. But we do have enough knowledge, I think, and exposure to these people that since they come in and see us, and they probably have not seen a physician and told them that they have the hair growth problem. They don't reveal that to their physicians. And if they have revealed it to their physicians, the physicians haven't immediately gone and said, okay, well, you need a medical workup. Most of them don't want to do it anyway, unless they're really pressed for it. And so when we see these people, we're the ones that know about it. And so if we can screen them and then alert them that maybe there's something that they need to get checked out, then we're not acting in an unethical way by removing a symptom that might be something that they need to know about. Because if you have people who come into your office that have been somewhere else that have been treated for years and years and years and years, you have to ask a few questions. Well, why? Why are they having this problem? And why do they have all these symptoms? Do they have the symptoms because they have something else going on, or, what's going on? So that's,
Diane?
yes.
I had a customer call from New York.
Mhm.
She was just looking for an electrologist
Mhm.
because her electrologist retired.
Mhm.
She goes, I really hate to see her go. I've been with her for 20 years.
Mhm.
I said, oh, you're having full body work done? No, just my face. And so I'm thinking, wow, maybe she can get, connected with an electrologist who's either going to then help her with maybe a hormone problem, or it was a really bad electrologist that couldn't
Yeah,
get
but
their
I got ladies come
determinants.
to me that say, I've been doing this for 20, 30 years, whatever. The thing is, they come in this month, they do a half-hour session.
Yeah.
You don't see them for 2 or 3
Mhm.
months.
Yeah.
and
Or
then-
years.
Yeah.
That's why on here, it's really important, beginning frequency, ending frequency, how long, how many years it's into you, and maybe they've got a problem and they've got it under control, and then they don't see it again for several years.
Mhm.
Or it's sort of like one of those things where they come in and then they don't come in for a long time. Something interferes with their treatment schedule. And then they come in again, they'll say they've been coming in for years, but it's not continuous treatment for years. So you really have to question them
Yeah.
and say, have you really been coming in for years and years? How many treatments? And you go and you look at their history and they've been in 10 times. And it's like, over 20 years, that's really not, you know.